Spondylosis is when there's a fracture on the back part of the spine called the pars. Spondylolisthesis is when that fracture results in bone instability where one bone slips forward on the other. A fractured bone hurts, and the spine is no exception. This area keeps rubbing itself together and keeps moving this fracture over and over throughout the day and throughout the years. Because of this fracture, the biomechanics are altered at this level, and this disc space rapidly wears out due to the stress of the flexion extension going throughout the entire day. This rapid motion wears out this disc space at an accelerated rate. A common presentation is a patient who's active, physically fit, and during certain activities, their back gives out of them or refractures this bone back there is usually the presentation. Or because this fracture has led to instability, this disc space is wearing out of them rapidly. This leads to several days every couple months of the back giving out on them. When the disc space wears out, the nerves start to get pinched, causing sciatica. This is a patient of mine that eventually got better through surgery. You can see when they lean forward, the fracture gap opens. When they lean back, the fracture gap closes. This constant movement causes pain. So to recap, when you hear about spondylolysis or spondylolisthesis, this just means there's part of the spine that fractured and it has inappropriate motion and inappropriate movement. This altered biomechanics then wears down the disc space rapidly. The underlying pathology here is a fracture. The only way to treat a fracture is stabilization. Adults are too big to wear a brace to fully stabilize this area, so instead the most reliable option is this minimally invasive surgery where you have 2 to 3 small incisions over the body that stabilize this area. This is something where patients might be able to go home the next day, usually the day after. They're able to start driving a week later, can return to full activities 2 to 3 months later, can start physical therapy just 6 weeks after the surgery.